Hi everyone, my name is Amel Ghouila. I am a bioinformatician by background, and I support the coordination of a data science for public health program in Africa, India, and Brazil. I'm very excited to be part of the discussion around harnessing the power of data, and I'll be talking about the use of data science for public health in low and middle income countries, and try to talk a little bit of the challenges that are mostly related to the digital divide. So a lot of the perspectives I'll be sharing are basically based on some of the work I've been doing in terms of bioinformatics and data science capacity building in Africa as part of H3 Bionet and H3 Africa, and also the African Society for Bioinformatics in Computational biology, and some other work teaching young girls coding and entrepreneurship skills to solve community issues. So data science methods and AI are becoming a key to translate biomedical research data, and are definitely changing the way healthcare is being delivered in many high-income countries. And the data science-driven intervention could basically be categorized into these 5 different categories, starting from studying susceptibility to diseases to predicting outbreaks and surveillance, and also planning and informing health policies. While this is very promising and raises a lot of hope to accelerate and improve healthcare coverage in low and middle income countries, it also comes with a lot of challenges that do require a thorough assessment of the context, and also study the adapted tools and strategies to avoid any potential harm, and also human rights violations. So the context, again, is very important, and I'll try to talk about the context from a digital divide perspective. So I'm going to use these 6 different axes that could help understand a little bit the digital divide. So we obviously talk a lot about disparities in terms of access to technologies in different parts of the world, and it is especially the case in low and middle income countries. We also access and interact differently with technologies based on gender and also generations. And these maps here shows the percentage of women accessing mobile internet across the world, and as we can clearly see that percentages are lower in low and middle income countries. Language is also another barrier that could lead to digital divide, and the other 2 categories I want to mention here are culture and religion, that could also lead to disparities in terms of accessing technologies, and also the way we interact with technology. And all these could lead to, when we collect data, all these aspects could lead to missing data, collecting irrelevant data, and or also collecting small quantities of data that are not representative of a certain population. So if we think about the digital divide in terms of geographies, we do definitely have limited access to resources in low and middle income countries in terms of accessing storage and computing resources, but also accessing internet connections. And even though it is getting better in many of these regions, it is still not affordable to have a stable internet connectivities, and costs are very high. The maintenance and administration costs are also quite high and do require some specific administration skills to be developed. When we talk about low and middle income countries and adapting tools and data science methods in this context, we're also talking about a very different public health system context where we have very different norms and practices, starting from the administrative process to treatment, epidemiological studies, etc. This geographic digital divide do also lead to a skills gap. And there's definitely a lack of digital skills, especially among the health workforce. And the health workers are in general overloaded and do have a quite heavy administrative process they need to go through. And we also notice that there are a number of very focused scientists and also a quite big disconnect between the different disciplines. And there are a lot of obviously capacity building programs that are helping overcome this, but the gap is still existing. When we think about the low and middle income countries context, another relevant aspect to think about is the fact that regulatory frameworks are very divergent, and there's a lack of clear frameworks in many countries. And sometimes processes are slightly different and are quite complex and require a lot of bureaucracy. In terms of data protection and information privacy. And adapting tools from one context to the other could also come with a challenge that what is considered appropriate and ethical in a certain context might not be appropriate or ethical in other contexts. So when we talk a lot about increasing diversity in data and how the diversity in data could help decreasing and tackle inequalities as part of global and international efforts. And so collecting data, trying to capture as much data as we can from this region and integrating them into global efforts could definitely lead to generating a data colonialism fear, where basically ethnic minorities and communities from low and middle income countries do really feel a lack of ownership of their data, and also a loss of confidentiality. And quite often when this data is taken away from their community, we talk a lot about helicopter science, where data is taken away, being analyzed and explored in other environments where we have access to more resources in terms of data science skills, but also in terms of computing resources. And unfortunately, in many cases, the results generated do not necessarily help the community, but they mostly help researchers, and also help researchers in terms of publications and generating results, but don't necessarily benefit the studied community, because sometimes there's a very little understanding about the community they're studying. And so when we also collect a lot of diverse data in the frame of international or global efforts, we quite often go through a data harmonization process where we try to standardize data and formats into coherent data sets for the purpose of a comprehensive global analysis. This might come with a lot of challenges, and there are a lot of factors that could impact the quality of the data, and the data is very context dependent. There might be a lot of missing data, a lot of incomplete data, and also a lot of data that is wrong, and this could be related to many different factors. One of them is the education level and the process of collecting the data. The process of collecting the data doesn't necessarily take that into consideration. There are also other factors related to the fear of being judged, lack of trust, which could lead to people not communicating the right information, or communicating only part of the information, which is not necessarily enough to include in an analysis. So even when we try to have the most representative data set or sample from a given population to include in a harmonized data set, there's a lot of bias that is carried in that sample taken from a specific population. And that bias is definitely carried in the models that we build based on that biased data. And these could definitely lead to more and more biased decisions. And another aspect is when we build systems that do not really take care of the context, we might be amplifying the bias when generating these models, and that will amplify more and more the bias we have in the decisions. And so designing systems where we try to understand data collected from different populations to answer very specific questions could carry a lot of bias. And we really need to think very carefully about the design process of these tools, and also try to assess different scenarios to make sure we have a very good management since the beginning, and a management of the intended consequences to avoid having a bad design leading to potential harm in these communities. So a way to think about this is to think about have the design be human-centered and very adapted to the context, and try to have an approach that is based on understanding the needs of a given population, instead of trying to have an approach that is based on tools that we try to adapt to a certain context. It is also very important to try to bridge the gap between the community we're studying and the study itself. And also another important step is to engage with regulators very early on in the development process in order to address any critical issues that might have regulatory implications later on in the process. So again, having an approach be multidisciplinary and inclusive as much as we can to encourage co-creation in which all stakeholders are involved in the process, including clinicians, advocacy organizations, etc. And bringing to the table a diverse group coming from different perspectives and helping to embed different values and different priorities in the design is definitely a key. And having people who really understand the needs of the community and also having the capability to interpret and curate and analyze the data set is definitely crucial. Another way to, I shouldn't say another way, a complementary way to help avoiding biases in systems we design is to make systems, instead of making them a black box where we really know only what we have as an input and what we have as an output without really understanding how these black box work. A good way to go about that and to help identifying biases and address them is to make tools and code available to the community. And by making tools available and accessible to the community is basically to communicate them in a way that allows reproducibility and allows others to replicate the work, to replicate the analysis we're doing and identify potential biases or adapt to a certain context. And it is also very important to design tools that are independent of hardware or of a specific infrastructure, or that are dedicated to only native language speaker, etc. So it is really important to make tools as inclusive and as comprehensive as possible to have tools designed in a way that they answer community need. It is also important to think about a dynamic development process where we think about how long are the analysis results and recommendations are going to be retained, how often do we need to update the tool, and how do we need to go about that. And an agile process based on continuous and iterative development and improvement is certainly a good way to go about that. So to conclude here, bringing diversity in data we collect and trying to harmonize all these data sets to better answer public health questions and reduce inequalities to health is great, but it's not, it doesn't answer the totality of the problem. And we definitely need to bring diversity throughout the whole research process to try to reduce inequalities and develop more and more tools and systems that are adapted to community needs and are respectful of the ethical environment and framework of certain settings. It is also very important to think about investing in people and investing in training people to work across different disciplines and know how to communicate with each other and be part of a co-creation and design process to design systems that could lead to improving access to healthcare. Thank you.